we have a keynote from Dr. Noha Aboelata. She is the founder and CEO both of Roots Community Health Center, a community health center licensed by the state of California Department of Health Services, and the Roots Community Alliance, a professional association comprised of safety net providers committed to the care of the underserved. She is a board certified founder of healthcare institutions and an advocate committed to eliminating health disparities among low-income populations in East Oakland and surrounding communities. As CEO of Roots, Dr. Aboelata is responsible for overall organizational strategic direction, programmatic design, contracting and oversight, leadership and management, including oversight of financial management, HR management, and community partnerships. So wonderful to have you, Dr. Noha. How are you?
I'm doing great. Thank you. It's great to be here. And thank you to California
I
Black
thank you for
Health.
being here. And I, Dr. Noha was one of the voices at the beginning of the pandemic that was gracious enough to join us on KBLX live on Facebook. That was like a resource for so many people when we were like literally in lockdown, and you answered so many questions and you had such great information. So, you know, thank you so much for the work that you've been doing and, you know, for being with us today. So it is all yours. You have the floor and we are all ears.
Thank you, Nikki. You're always an amazing host. And yeah, thanks to the California Black Health Network for hosting this amazing, just very necessary conversation. There's been so much shared already. And I was asked to talk about social determinants of health and how we think about them and approach them. And I could not agree more with Zanet stating it is structural determinants of health, and that is absolutely true. I thought the best way really to talk about how we think about structural determinants and how we've approached them is just to share about Roots and share about how we came about and why. And how we approach the work, because it really is about addressing the whole health of our members and of our community, and not just focusing on just disease treatment. So I will go ahead and share how we create an ecosystem of what we call whole health. And so I'm the founding CEO at Roots, and my co-founder was Nurse Ophelia Long, who maybe some of you might know. She joined the Ancestors in 2020, but she was an absolutely fierce advocate for her patients, for the community, and definitely the Roots family is proud to call her our co-founder. This was the Roots team the last time we were able to congregate like this in 2019. We've grown since then. We're now at about 200 strong. And really, Roots was founded in the first place to address longstanding disparities in Oakland. And we really honed in specifically on East Oakland because of all what the data was showing and telling us. I remember looking at map after map after map that looked like this one on the left here, just lit up in the same areas, you know, particularly in East Oakland. This map on the right, this is actually October 18th, 2020. But this hasn't changed much. This was COVID cases, again, the same area lighting up in East Oakland. And really, East Oakland lights up on so many different indicators, so many of the disparities that have been discussed today already. But not just health disparities, you know, not just birth outcomes and cancer disparities and diabetes and smoking, but unemployment, educational attainment, probation and parole. And we know that so many of this is due to really structural legacies of racism, racial profiling, redlining, which we can see here. Many of you probably seen this map from like the 1920s. And so these things are, have been designed this way. So the system is working as it was designed to work. And redlining is just one of the systematic ways in which Black communities in particular have been locked out of economic opportunities, and then all the things that we know that follow from that. And so in founding Roots and in really exploring, well, why do we have these intractable disparities, the disparities that just will not get better, that were particularly severe for Black men who at that time really could hardly access healthcare until, the Affordable Care Act came about. Medi-Cal was really designed for women and children. So we had, again, the systematic locking out of Black men in particular from healthcare. And we saw that played out not only in healthcare, social services, where you have systematic ways in which families are kept apart, Section 8, many types of assistance are for women and children. If there's a man in the house, you got to hide him or have him get gone because you wouldn't be, qualified. So these are all structural issues that were placed there and that have created many of the disparities that are, continue to be maintained today. And all of the things we know about disproportionate. We heard about stop and frisk earlier from Carol Magruder, and about just the criminalization of behavioral health issues as well, and the disproportionate burden of chronic health conditions. And so all of these things, as myself being a physician, it's like, well, how am I a physician here trying to take care of sick people when all these huge things are going on at the community and at the system level? How can I address this if I'm in the exam room? And so for me, a lot of it was about, well, what kind of structures, first of all, what structural changes are needed, but also we can't wait for that. We need to meet the issue today head on where it's at. And so that was really sort of the impetus behind founding Roots. And so our mission is to uplift those impacted by systemic inequities and poverty. And I just like to highlight our mission because there's a lot of health organizations out there, and I think our mission is a little bit unique in that it's about uplifting those impacted by systemic inequities and poverty. So right off the bat, we're acknowledging that this isn't just about treating diseases. This is about addressing what are systemic issues and really the drivers of poor health across the board. We accomplish this through medical and behavioral health care, health navigation, workforce enterprises, housing, outreach, and advocacy. And of course, advocacy is so critical. It's so wonderful to hear from so many of the advocates that spoke out today already about how we really do need to be, as much as we need to be meeting immediate health needs, we also need to be advocating for systems to change, because we're not going to be able to get there just through direct services. So we've grown to a number of sites. We deliver full scope primary care at 3 sites, 2 in East Oakland, 1 in San Jose. We also have a number of satellite sites. We have satellite sites within youth shelters where we're really able to meet young people where they are within drop-in centers at youth shelters where they may be going to access other things, like a shelter bed, but we're right there providing medical care, and under the leadership of Dr. Aisha Mays, able to provide at the time and place of need both healthcare and behavioral health care and a number of other wraparound services. We also have our street medicine clinic, which is a mobile clinic. It is led by Dr. Danielle Williams, and it's a physician-led team of 4 that goes out into the streets in the encampments of East Oakland and brings primary care and episodic care to those communities, really with a goal of developing those relationships and creating a bridge for folks to be able to know where to get care when they're ready. And we know that that may take a number of visits from that street medicine team before they decide to come in and seek care. But we really are about promoting that self-advocacy and self-efficacy that we know is required in order to navigate systems in general, and in order to really get the care that we all have the absolute right to. And then we have a few workforce training grounds that are our social enterprises, Clean 360 and Hamilton Broadway Signs, and I'll talk about those a little bit more in a bit. But we develop workforce enterprises because if we started with the understanding that structural inequities and poverty were underlying poor health outcomes, then what were we going to do about that? And that was one of our questions from our early think tank with Nurse Ophelia, myself, and a number of other similarly concerned folks that, well, what are we going to do about that? Where we deliver healthcare and we can train folks in the health professions, and we do a lot of that. But for many of our community members, healthcare may not be their interest. And also, unfortunately, if you have a felony or even a misdemeanor, it is still very difficult to obtain licensure and to obtain jobs within the healthcare field. And that's something that we do advocate for quite a bit. But in the meantime, we realized one of our charges was to understand how can we help support people to get into the workforce so that they can lift themselves out of poverty and be able to improve health outcomes for themselves and for their families. We also run the student health services for the Peralta Community College District. That is a very important relationship because we know the community colleges are so critical in terms of helping people with their own advancement. So we're very pleased to be able to be right there on the campus to be able to serve really who are our mutual community members. And then we also have emergency workforce housing that we run in partnership with the city of Oakland, and those little tiny home, tiny shed, units. And we really use that very strategically in order to help get people out of the encampment, people who are ready, willing, and able to work. And we absolutely wrap everything we have around them 24/7 in order to support them, in order to meet their goals of self-sufficiency and being able to get their own place and be able to afford their own rent. And that is something that's been very successful, and we're very proud of that work that's happening there. And so some of our commitments and some of the ways in which we approach our work is that our intake is a little different. We really try to be very comprehensive in assessing a number of different domains of life. So it's not just about how many illnesses you have and how many medications you're taking, which is really the majority of what we see when we, go to a new doctor's appointment. But we really want to identify what are folks' goals, what are their barriers, and what are the needs, and how can we support them to achieve those goals. And the real secret sauce behind that is our navigators. And I know we've heard from a few very powerful navigators already today. And so if you didn't know already, navigators are a powerful ally and partner really to our community members who really need that additional support in navigating the systems that are really just too complicated for most of us to deal with. And it is not just about making sure you pick up your prescription or don't no-show your doctor's appointment. It's about making sure that if what you need is stable housing, if you are food insecure, if there are issues surrounding mental wellness or substance, relationships, communication, mobility, a number of different domains of life that we've identified that are important to overall well-being. And if people are coming in crisis mode in some of those, then far be it for us to say, you really got to get that, you really got to get that mammogram today when you're living in your car and you don't have access to food. First, we're going to help you, help address your needs and goals that are most presenting to you. And sometimes it's not even that clear cut. Sometimes it is, we have a parent who is depressed because maybe they have lost contact with their child, or of custody issues or other things like that, where doctors don't often ask those questions in the exam room, but it is our role to ask those questions and answer those, and really answer those needs. And in hearing the last panel with Dr. Chambers and with Daphina, and just hearing about the need to be able to center what are those needs before we get on with what it is that we need people to do. It really is, truly a partnership. And being community centered means listening. It means connecting with our community. It means that yes, we might have expertise. We might have gone to school for, whatever it is that we specialize in, but the real true experts are the people who are experiencing the issues, are experiencing the injustices. They're the ones that can tell us best what the barriers are and what we need in order to, cut through those. And so it really does take not just listening to individual patients, but actually holding space, whether that is through listening sessions or focus groups, or surveying folks that are coming to receive services, not only so that we can improve what it is that we're doing, but so that it can inform us on what kinds of systems change we need to advocate for. And that follow through and that follow up is so important. And it is oftentimes the missing piece. We've heard, even from the first presentation this morning, about how there may be resources out there that just are underutilized or not utilized, or maybe people start a process, but they don't finish a process. So we really try to emphasize the importance that we are following through with what we start, and we're following up with folks on what it is that they need, whether that is on an individual level, on a household level, or at the community level. And, you hear about no wrong door, but really we are about no wrong door. I mean, in fact, I don't even think about it as doors in some ways, because we're everywhere. We're in the streets, we're in the encampments, we're at the jail. We literally have a site in the jail parking lot where we receive folks who are coming out of incarceration. And folks may come into, buy soap from our Clean 360 social enterprise, and, maybe coming in to inquire about their son or their nephew who's just getting out of incarceration, and is there opportunity for them there? So wherever you may encounter us, we really are coming with the same approach. And wherever we may be doing that intake and that assessment, it is really the same. We may do it a little shorter or a little longer, depending if we're under the freeway or whatnot, but the goal is still the same. And the approach is still the same. And our desire to link and follow through is still the same. Our staff, is how we get it done, is how we accomplish our mission, is because we've got 200 people pushing towards the same goals and the same mission, and our staff reflect the community. And this is something that we're very intentional about. It's not only about race and ethnicity, although that is a huge part of it. It is important that our communities see a team that looks like them. And so this is something that we actually take very seriously, and we keep track of, is that our team represents the community that we serve. And we know that that's not the end of the story. It also, takes a lot of situational awareness and really understanding the absolute diversity of the folks that we serve and all of the different situations that they may be coming from and so on. But this is a good start, having a staff that reflects the community, that is from the community, that understands what it is that their members are going through, and that can speak, just like Zainat was talking about, that can absolutely speak in a language that is understandable and is relatable. So we really think about our work in a few different categories. Care is really full scope. Primary care, behavioral health care, again, from folks who look like you, and for the entire life spectrum, from our babies to our elders and everybody in between. It includes street medicine, which I shared a little bit about, and this is an amazing team that will go, directly to where they are needed in order to address folks at their time and place of need, and whatever that need might be. With COVID, we absolutely stepped up into COVID. We continue to test and vaccinate and provide services directly to our community. And what we found out that was a need that we felt like we needed to fill was sort of this information vacuum. Well, at first it was a vacuum, then it was an overload, then it was a disinformation and a misinformation. And so us being able to communicate directly with our community was such a critical need. And this is something that we took on in so many different ways. So many of our physicians, you can see here, have participated in many different venues in order to really bring credible information that was relatable, directly to our community. And this is something that we've continued. We have the People's Health Briefing. We've continued. It is every Tuesday morning. It's sort of hard to believe we've been doing this since July of 2020, and the need continues. We talk about COVID, monkeypox, flu, all the things that are facing our community, even community violence, other things that are directly facing our community, really emerging threats to our health and well-being. And so we really bring that timely information in about 30 minutes every Tuesday morning on our YouTube and our Facebook Live. And we've really built out an amazing communications team at Roots that has, not only deep background in communications, but also expertise in public health, and really able to deliver community health education that is timely, that is understandable and relatable. And this is something that we don't see going away. This is something that we have found to be very important in order to get information out to more than just people who are walking through our door, right? It's to really get credible information out to our broader community. And we get feedback from all across the country about our communications. So this is something that we know is resonating and is a very high need. Navigation, I've spoke to a little bit already. Navigators are the largest job class at Roots. We have more navigators than anything else, medical assistants, doctors, all of it. And that is really because of the absolute importance of having folks who can be that point person. Navigators have their own panel of members, and many of our navigators share direct lived experience with the members on their panel. And so we have navigators who have experience of being impacted by incarceration themselves in the past. And now their panel is comprised of all people who are coming out of incarceration. So we don't have to have misunderstandings or lack of understanding. We are starting from a place of understanding and really developing that relationship that makes it, much more effective in terms of getting folks who really have avoided healthcare, maybe for their whole life, who've never meaningfully engaged with the healthcare system, and really getting them to value and protect their own health and well-being, advocate for themselves, navigate the systems that they have every right and absolutely deserve to be able to access. And their navigators end up being that main point person to assist them with that. Navigators are trained. They are community health outreach workers. They are health coaches. They are life coaches. Many of them have specific expertise, whether it's with family navigation, youth navigation, violence intervention navigators have panels of people who've been recently involved in gang and gun violence. I mentioned our reentry navigators, and so on. And so really this is about absolutely reflecting the community, but also having professionally trained navigators who understand their critical role in moving people from that crisis situation into a place of secure not just on their physical health and their mental health, but on all those other domains of life that I mentioned. And that is how we measure our success. So it's not just about getting the blood pressure down and the hemoglobin A1C down. It's about, does this person have a more stable and secure life now? Has this person moved from a crisis situation into a secure situation? That's how we hold ourselves accountable to the work that we do. And these are just some more of our navigators. And empowerment is so critical. It takes on so many different forms. I could do a whole talk about the role of empowerment and how we really uplift that. But one example is in protecting our community's vote. We have one of the only ballot drop boxes in East Oakland, and it was no small feat to get it there. It's in front of our main campus at 99th and East 14th. And our team was out there until the registrar took every last ballot out of that ballot box last night. We had it lit, we had it covered up so folks could come, even though it was raining, it was cold. We had the heat out there, and we wanted to just ensure that our community had a place to make their voice heard. And it is really important that we uplift that, and we understand that, again, community health is about so much more than treating illness. It is really about the structural changes that are needed, and this is just one of the ways in which we can impact that. We also create opportunities for self-sufficiency in our Clean 360. We make natural bath and body products. We pivoted during the pandemic to also, well, not pivoted, we added hand sanitizer on because that was such a huge need, and we were able to provide hand sanitizer to many of the City of Oakland departments and other systems that were having a tough time sourcing it, especially early on in the pandemic. We moved very quickly to meet all kinds of needs in the pandemic, and this was just one of them. But Clean 360 trains folks who've been marginalized from the workforce for one reason or another, and really builds not only the hard skills of light manufacturing, but also the soft skills that are needed in order to successfully enter the workforce. And one of the ways in which we walk the walk is Clean 360. It's under our nonprofit umbrella, but we sell products. And our goal is, again, in terms of the advocacy, is that every if it's a government agency, if it's the jail, if it's schools, or if it is even businesses, hospitals, and so on, consider purchasing from places like Clean 360 that are not only making amazing products, but we are transforming folks' lives. And when we are keeping people out of jail, out of the emergency room, out of the psychiatric emergency room, by creating opportunities, then we know that this is a win for everybody. And so we really want to emphasize that socially responsible procurement is one of the pathways towards equity and towards eliminating disparities, because this is how we put resources back into our community. And so we should all be thinking about where we spend our dollars, but also wherever you work, they have a purchasing department or a procurement department. How are they making decisions about where they purchase and who they purchase from? Is it just about the cheapest way to get the widget, or is it about really uplifting community? And this is something that we really want to make sure that we emphasize and that we stay conscious of. And I mentioned the hand sanitizer production. Hamilton Broadway Signs is our second workforce enterprise. We make and install commercial signs. This has been an amazing training ground, especially for young people who are interested in graphic design and creating signs. And it turns out to be a really great path to very good careers. Who knew? I didn't know. But there are only so many sign shops, and we purchased the oldest one in Oakland, Hamilton Broadway Signs, from an owner who was very committed to seeing her business stay within the community. And so we're very blessed to have been able to acquire this business, and it is a thriving business. And once again, every business needs signs. Every time you do a construction project, have a new building, you need signs. And so Hamilton Broadway Signs will not only get you great signs, but you will be supporting folks who have been marginalized from the workforce and investing in their training and their future as well. And so that concludes my presentation. I'll stop sharing there. I think, I just want to say that this whole day has been really inspiring to me, and it just kind of reinforces my belief that we have everything we need within our community and amongst ourselves. And so a lot of it is, as you said a few times, Nikki, connecting those dots, knowing about one another and the work that we do, and uplifting one another, and really trusting ourselves and trusting one another that we do have everything that we need. We do have to advocate, though. There's no question about that. We have to advocate for systems to change. We have to advocate for the resources to flow in the right direction, so that really we can make the changes, because there's no question there's a lot of work to be done. There's major disparities that haven't been fixed in all this time. And so we do have our work cut out for us. There's no doubt about it. But I'm just so inspired by today, and just really want to thank you for the opportunity to speak with you all.
Wonderful, wonderful. And of course, we've got plenty of questions popping in the chat. So I'm going to throw a few questions. Thanks for all your work. This is like an actual, comment here. Thanks for all your work, Dr. Noha. Does Roots provide trainings/workshops for healthcare students and providers about your innovative community-based holistic approach?
We do. I mean, we train so many healthcare, providers and aspiring healthcare providers, sort of along the continuum from, maybe young people who want to become medical assistants all the way up to medical residents. And so anyone who comes to Roots, we are, a big part of our initial onboarding and training, and this goes for our navigators as well, is about structural determinants of health. It is about systemic racism and systemic inequities. It is about understanding all of the things that I kind of discussed, touched upon today. Because we really believe that all aspiring people who are going into healthcare absolutely need to understand these things and need to understand how harm is done. And so we do quite a bit of orienting and training on that. We would love to host broader workshops and trainings. And so I would love to, absolutely, anyone who's interested, I will put the email in the chat here, because we'd love to talk about doing it on a broader basis, more outward facing towards the community, because I do think that is absolutely a big need. I wanted to uplift what I was getting to earlier about one of Daphne's comments in the prior, section about non-compliance and how these labels are so damaging. And I don't even think that most healthcare providers understand how much damage that can do. So being, very mindful of our words and about how we label people, and that we understand that we in healthcare have to take responsibility. When you start pointing, you start blaming the patient for everything, and especially for our own inadequacies. I think if someone is so-called, non-compliance for me, it's a relationship. And so much of what I've talked about is about developing those trusting relationships. And so if my patient doesn't want to do something that I'm recommending, they usually would tell me, Doc, I'm probably not going to do it, or they come back, sorry, Doc, I couldn't do it. That's not non-compliance. That's us being in a relationship, and just real life. And I think one of the things that is not so well understood within the health community is that when you put a label like that on someone's chart, the providers after that taints their view, just like was explained. And then the doctors might not try as hard because they're just figuring this person's not going to listen to us anyway. So we have to really get away from this paternalistic way in which I think medicine has worked for so long, and realize that it is about a partnership. And if someone if we're not improving someone's life, that's a two-way street. This is on us also. And so I think taking responsibility and taking accountability, it starts with us. It starts with us being accountable to what it is that we're doing. And I think Dr. Washington talked about it really well as well, is that we have to look within. So we have to look at our own systems. If you work at a hospital, yes, there's accountability for hospitals. They have to report all kinds of things. But are you looking at your own disparities within your own system? Do you have disparities in your own patient population? This is something that we all need to be holding ourselves accountable to, and taking it upon ourselves to say, you know what, to get rid of this disparity, it's going to take extra effort, because we're having to overcome legacies of inequities, and we're having to also fight against structures that are still inequitable. So guess what? That's going to cost more money. So we have to fund towards equity. It's not just going to happen because we all care about it. We actually have to fund to get there.
Mm-hmm. So where can the community members go to purchase the natural products from Clean 360?
So we do have a retail spot at 4107 Broadway in Oakland, and also clean360.org. We ship everything everywhere in the country.
Oh, that's good news. Good news.
And it's amazing. You will never go back. You will never go back. When you try
Another
Clean
audience
360
question here. You know, when you say Clean 360, that means everything's going to get clean and out of it. So next audience question, have you thought about opening a site in West Oakland?
Well, we certainly have been asked about that, and we, you know, I would never have thought we would have been in San Jose. I thought, you know, after East Oakland, maybe Richmond, maybe, you know, but the community asked for us. The community laid out the disparities. The community advocated. And was relentless. So it was the advocacy of the Black Leadership Kitchen Cabinet and the leadership in San Jose that said the county, you know, has never had an African-centered clinic in the history of the county. We need you here. And they didn't stop asking, and they laid out, you know, the need, the disparities, and the gaps. And so anywhere that our folks are that are not receiving the services, or where there's a need, you know, absolutely, we're here to absolutely hear about it. Know that, you know, we have our hands full in East Oakland. But we absolutely are here for our entire community, however that might look, you know, whether that is partnering with organizations who already exist in certain geographies, or whether that is us establishing our own site. But absolutely, we want to go and fill the gaps. That's how we've really done a lot of our work, is sort of, we look first to see who else is here, who else is doing this, what else is going on. Maybe we could just be in partnership and support one another. Or maybe we do need to begin a new service, or a new program, or a new offering, or add a new site. And so we are in downtown at the youth sites, and also we have, you know, our transitional workforce housing. It's a little bit closer to West, but it's still east of the lake. But so yes, we're here to definitely partner wherever it feels like Roots is needed.
Wonderful. Okay, let's see if we have any more audience questions. So where would you like to direct us as far as getting a hold of you to connect, learn more, or to put us into action anywhere?
Absolutely. So our website is rootsclinic.org. And the general email, which is constantly monitored and routed, is admin@rootsclinic.org. And of course, we are on all the social channels, so please follow us and, you know, engage with us there as well. Roots Empowers, those are our social media.
Well, I love it. Love it. Well, I feel informed. I feel empowered. I feel like, you know, I'm going to get really clean. I feel like everything. I can do any and everything. Thank you so much. Thank you so much for your wonderful presentation and for being with us today. I'm going to take a chance and see if my video is working properly. Okay, there I am. The hair is big and fluffy. Thank you so much for allowing me this honor to be your host and MC today. This has been so amazing, again, empowering and eye-opening. The work that I've been doing with KBLX is one thing, but the true change and transformation and power happens when we link up with our community and really dig deeper for the answers and the action plans from leaders and experts like the ones that we've talked to today. So this has been so amazing and so wonderful. And if you notice, the sun has come up on me, and that means we've spent some good time together. Thank you so much to Rhonda and Brittany and the entire family, California Black Health Network. I feel like I've done some good work, and I feel like my next steps are there to step into community with this new level of self-awareness. Thank you so much. Thank you, Idris, Nikki, representing Health Uplifting Me. Thank you so much. I appreciate you saying that. So I'm going to hand it over to Brittany and Rhonda for the next parts of our sessions today. Thank you, ladies, so much for being beautiful, bold, informative, and for having me today. I really appreciate it. Thank you.
So yes, so we thank you, Nikki, for all the good work that you do in the community, for the community, and for being part of our program today, even though I know exactly where you are, and you know that we appreciate you staying up until the sun came up to be with us today. So
it was a pleasure.
Yeah,
and an honor.
Yes, and it's pleasure's all ours. And also want to give thanks to all the speakers and panelists who were part of the event today to really make it such a powerful session and a productive discussion and a learning opportunity for all of us about what's happening in Alameda County, as well as in general when it comes to health disparities and how that impacts the Black community, and all the things that we need to do, especially focusing on things at the system and structural level that creates these inequities to begin with. And then Brittany, I want to give a thanks to her for all her hard work in getting us to today and mobilizing everybody and making today a success as well. And so just a few comments that I wanted to make and things that I heard. And I guess I'll start with one of the last things that Dr. Noha said. And she talked about funding. And, as a nonprofit, yeah, we're on that treadmill also all the time. And so, when we talk about really making change and driving lasting change, funding is important, yes, but it has to be a long-term commitment. Really doing projects that address health disparities on a 2-year, even 3-year window is really not long enough. And so, helping to build the capacity of organizations that are on the ground doing this work is an important thing to do. And we're blessed that some of our funders recognize that, but it does take a village, it takes money, and it takes a long-term commitment for us to see, real change. And that real change can come from, something that someone else, I can't remember, I think it was a common theme too, like anything about us, right? Or for us has to happen by us because it is about us and for us. And so I think Z mentioned this about getting involved and being on those commissions that make decisions about what type of investment and resources do go into those communities. So running for office, right? That to drive policy changes. One of the things that, it's very evident in the work that we do that, policies do dictate investment or disinvestment in certain communities. And those decisions really impact or drive the social determinants of health, which then impact not only access to resources, but the quality of life for individuals and then health outcomes for individuals. And that leads to health disparities. So people at the end of the day are the ones who are control and enact policy. So we can get involved in that process and drive the kind of policy changes that we need that can positively impact our communities and really change what is happening in our communities. So let's see, and really, you know, the work that we try to do is getting at the root cause of health inequities. We want to spend our time and resources, you know, really trying to crack the nut, right, that causes this, all of this to begin with. And so we'll be focusing on and partnering with some of you around policy programs and other initiatives to really get at the root cause of these issues. And we know that it's not race, it's not based on race, it's really based on racism. And so until we're able to dismantle those racist structure within the healthcare system, we're still going to be having this conversation a year from now or 10 years from now. So we have a lot of work to do and a lot of heavy lifting, but coming together to do this work together is an important, I think, key success factor to have happen. So I'll turn it over to Brittany, and she's going to talk about what happens next and where we go from here. But again, thank you everybody for being here today. It was an honor and a pleasure to have all of you participate. Thank you.
Thank you, Rhonda, and thank you, Nikki, and all the panelists and keynote speakers involved. I thank all of the folks in the chat and our attendees today that were so active and kept the conversation going. And I want to emphasize what Rhonda said, that if we don't take action on some of these things that we talked about today, and much more, you know, we're going to be here a year later or 2 years later, 3 years later. So I want to share that we are going to have breakout discussions from 2 to 4 today with some of our amazing keynote speakers and panelists, as well as some other folks that are professionals in the field. You will be able to have an uncensored, unrecorded discussion with folks in the community. Those are other stakeholders, Black professionals, Black community members, and more. Anyone that is invested in the health equity of Black people in Alameda are invited. You can invite your friends, you can invite your family. It is for a platform for anyone to have a voice and answer the questions of why these things exist, why these disparities exist, and what next steps and partnerships we can make together. So I will put in the chat very shortly the registration link. You have about 40 minutes to register, but we have Dr. Aboelata with social determinants, Dafina Melbourne with maternal health, Austin Wingate with COVID-19, Mary Blackburn with mental health, and Dolores Moorhead with cancer. So I welcome you all to register and be part of that conversation. And I just want to emphasize that the next step is to really bring this all to life. You know, not just listing the disparities that exist and why they exist, but CBHN offering solutions based on these breakout discussions, based on informational interviews and one-on-one discussions we have with experts in the field already doing some amazing work, and how to provide them resources to continue that work. And that is the goal of the Black Health Agenda for Alameda County. So I will keep you updated. Usually the process takes quite a while to accumulate all this information, but we want to be as specific as possible when offering up solutions and next steps we can take, whether that is funding, whether as partnerships, whether as collaborating. And that's why you all are here, and we're going to talk in the breakout discussions. And please connect with us via social media, Facebook. We're on LinkedIn, Twitter, and Instagram. You can also go to CaliforniaBlackHealthNetwork.org, that is CA-BlackHealthNetwork.org, to join the California Black Health Network, and also become a member, which is free right now, so for a limited time. And we could talk more about in the breakout sessions to respect time. And that is all, everyone. If you have any questions for me, I will be on for another 5 minutes. Otherwise, hope to see you in the breakout rooms. You will find the registration in the chat.